Hi, I'm Michele Cardoso, clinical specialist radiation therapist. Lymphedema is a persistent swelling that may happen after cancer treatment to the lymph nodes. Lymph nodes, vessels, and tissues form the lymphatic system, which works with the circulatory system to maintain fluid balance and help with the immune system. Lymphedema appears as a swelling, usually in a limb next to where the nodes were removed. People notice an unusual swelling, or jewelry feels tighter, or footwear feels uncomfortable. It's important that you address these symptoms as early as possible, since early intervention helps to make the condition much more manageable. There are many things in your power to do to help you manage lymphedema. The number one thing is skincare. Unfortunately, lymphedema opens you up to the possibility and risk of repeat infections to the skin called cellulitis. By keeping your skin clean and moisturizing, you're able to help your skin stand up better to infection. The lymphatic system is a pretty challenged system to begin with. The flow of lymph fluid through the body is pretty sluggish, and it really depends on you and your movement to keep it going. That is why exercise is really an important thing to add to your lymphedema regimen. So there are limb-specific exercises that help keep the lymphatics moving and draining. And there's also general exercise, which I will emphasize as important in terms of your overall well-being and ability to cope with lymphedema. Combining deep breathing with exercise, you get greater benefits to the improvement in the flow of the lymphatic fluid. It's recommended that you keep your weight down, so your body mass index, which is a ratio of your height and weight, keep that within 30. Treatment for lymphedema involves manual lymph drainage, which is a specialized massage done by a lymphedema therapist, which involves a very light touch. What it does is it finds new channels for the lymph to drain. Compression is also another form of treatment for lymphedema. Compression involves bandaging, special sleeves or stockings that help to provide a consistent, even pressure along the entire length of the limb. This helps drain the lymphatic fluid along. It's important to see your doctor to rule out other causes of swelling. Also see a lymphedema specialist who is certified in decongestive therapy. You should see the letters CDT after their name. There is always research being done and new surgical techniques emerging to help manage lymphedema better. Until then, skincare, exercise, lowering your body mass index, and seeing a lymphedema specialist are your best ways to manage lymphedema.